Hello, my name is Lexa Ingram, and today I'll be discussing the importance of offering comprehensive sexual health education to students while comparing it to abstinence-only sexual health education. I chose to write about the importance of offering comprehensive sexual health education due to the lack of sexual health education that is provided in the States, especially for individuals that are part of the LGBTQ plus community, as well as the social determinants of health that are disproportionately affect minority groups. I believe that we need to address all of these problems and that it is very important to provide all individuals with an equal opportunity to learn how to keep themselves safe when engaging in sexual activities by knowing how to properly protect themselves. From my own personal experience, I had a very brief and lacking sex education, which required me to have to educate myself, which should not have been the case. The most interesting thing that I learned during my research was how widely each state's laws varied from one another in terms of their sexual health education, and that it was mainly the school's decision on the type of sexual health education they chose to provide to their students, if they even decided to offer sexual health education. This results in variations of whether HIV education is to be taught, if the information is to be medically accurate. The generalization of the term medically accurate is defined as teaching comprehensive and religiously neutral sexuality education, including educating students about both abstinence and contraceptive use for the prevention of pregnancy and sexually transmitted diseases. Looking at the current state of sex education in America, 39 states and the District of Columbia mandate sex education and/or HIV education. 26 states and DC mandate both sex education and HIV education. 2 states only mandate sex education, and 11 states only mandate HIV education. With the push in public health for the implementation of more standardized sexual health education guidelines across the United States, it begs the question of if the curriculum should be abstinence only or comprehensive. In general, abstinence-based sexual health programs teach students that the only safe, effective, and morally acceptable manner to prevent STDs and unplanned pregnancies is by practicing abstinence, and oftentimes only discusses the use of condoms and contraceptives to emphasize their failure rates. Whereas in comprehensive sexual health education is medically accurate, evidence-based material that is non-biased and age-appropriate, with a curriculum that covers STDs, sexual expression, forming healthy relationships, practicing safe sex techniques such as using contraceptives or condoms, as well as having emphasis on gender identity and sexual diversity. LGBTQ plus students are often excluded in sexual health education. In fact, 8 states still include discriminatory language towards the LGBTQ plus students in their sexual health education. Only 6 states use inclusive language in regards to the LGBTQ plus community in their curriculum, and the remaining states chose to remain neutral, but lack the needed education for the community. Due to the lack of education for the LGBTQ plus community, data has shown that lesbian, gay, bisexual, and transgender students are at substantial risk for serious health outcomes related to sexual behaviors and sexual violence in comparison to their peers. However, these serious health outcomes can be reduced with the implementation of different programs, such as the Young Men's Health Group. The goal of the Young Men's Health Group is to reduce the HIV transmission rates among sexually active African American and Latino males. The Young Men's Health Group educates students on many topics, including gender and body image, LGBTQ plus identity and allyship, dating and hooking up, and HIV testing. Due to the program, there was a significant increase in the students' sexual health knowledge, the intention to reduce sexual health risk, respect for individuals with different sexual health with different orientations, and school connectedness, helping to demonstrate the positive impact that comprehensive school programs can have on students and help to promote the engagement of healthy sexual health behaviors and be used to create a safer environment for the students, especially for members among the LGBTQ plus community. Comprehensive sexual health education can also be used to teach individuals to build skills they need to identify healthy and unhealthy relationships, as well as harmful behaviors, which allows an individual to learn how to protect themselves and make educated and thoughtful decisions to improve their life in a healthy aspect. With programs like Discover Dating, individuals are taught how to explore relationships and how to form healthy interpersonal and intrapersonal relationships, as well as teaching individuals how to practice decision-making skills and build individual relationship skills. Due to the curriculum of building individual skills, adolescents learn to build their self-efficacy, personal agency, and resilience, which are all skills associated as protective factors for preventing teen pregnancies, domestic violence, and sexual assault. Adolescents and young adults are disproportionately affected by STDs. The youth aged 15 to 24 accounted for nearly half of the 2.6 million STD cases that occurred in 2018. It is also important to note that many STD cases are often undiagnosed or unreported, especially among the younger populations. Yet, despite the high rates of STDs among the youth population, there is a lack of testing, which is a part of result of the lack of sex education. In fact, in 2019, less than 10% of high school students reported receiving an STD or HIV test, indicating that students need to be informed of the importance of regularly getting STDs tested completing, as well as offering resources students can utilize. Looking at the rates of STDs by states helps to demonstrate the narrative behind the importance of having comprehensive sexual health education. As of 2019, Alaska was the state with the highest rate of STDs, with there being 848.1 cases per 100,000 population. Schools in Alaska are not required to teach sexual health education. It is a school's decision to provide sex education and choose the type of curriculum that they want to cover. If a school chooses to provide sex education to their students, information about the curricula or programs offered in the school must be available for parents or guardians to review, as they can decide to opt their child out of receiving instruction. Whereas in New Hampshire, the state with the lowest rate of STDs of 263.7 cases per 100,000 people, schools are required to teach sexual health education. Schools are at liberty to cover topics that they like, such as consent, but they are required to educate students about STDs, including HIV, healthy relationships, growth and development, and how to prevent unintended pregnancies in the curriculum. There are no mandates that the information presented has to be medically accurate, and parents and guardians are also able to opt their child out of receiving sexual health education based on religious objections. A common concern for sexually active young people is HIV, but it's seen at higher rates among lesbian, gay, bisexual, and transgender students. There is a current lack of HIV curricula in some states' sexual health education. Many individuals lack the resources or information that they need to understand how to protect themselves against HIV, learn how it's transmitted, and learn where to get tested or receive treatment if they have HIV. It is important that individuals know where to receive the sexual and reproductive services that they need. In 2018 alone, of all the new HIV diagnoses, 21% were among young people aged 13 through 24. Yet, despite the high prevalence of HIV among young people, in 2019, a survey found that 90.6% of the students reported having never tested for HIV. It is important to receive HIV testing, and it is recommended for everyone aged 13 through 64 to get routinely tested as part of their medical care. However, many students are hesitant to seek out testing due to stigma associated with the topic and the bullying that may occur. The introduction of the HIV programs in schools will help to limit these prevention challenges by encouraging students to seek sexual and reproductive healthcare services that they need, as well as offering referrals or on-site services if possible. However, stigma in education are not the only factors associated with the lack of STD testing among the youth. Confidentiality concerns also serve as a barrier. When seeing healthcare provider one-on-one, 71.1% of patients received a sexual health risk assessment, compared to 36.6% of patients who did not have alone time with the provider. Studies have found that young people are more likely to disclose information about sensitive health risk factors or discuss sensitive topics, including sexual health, when provided with an opportunity to talk to a healthcare provider alone or when confidentiality is assured. Schools are a great asset to use to increase students' access to health services by either offering on-site services or referrals to healthcare providers throughout the community for their students that are confidential, alongside offering comprehensive sexual health education for their students. Comprehensive sexual health education is also helpful in preventing teenage pregnancies. In 2018, teen girls aged 15 through 19 years old gave birth to nearly 180,000 babies. In 2019, the teen birth rate decreased by 4% from 2018 to 2019, with a birth rate of 16.7 births per 1,000 females. While the teen birth rates in the United States have been in a decline, the rates of teen mothers is still higher than in other Western industrialized nations. Reasons for the decline in the birth rates are not clear, but evidence suggests that the decline arose from more teens abstaining from sexual activities, as well as increased use of birth control among sexually active teens. Social determinants of health, such as having lower levels of income among teenagers' families, unemployment of the teen parents, and a lack of having educations, are contributing to higher teen birth rates. Adolescent pregnancies are negatively impact different racial and ethnic backgrounds. Hispanic, non-Hispanic African Americans, and African Indian and American Indian Alaska Native teens have more birth rates than twice the rate of non-Hispanic white teens experience. Offering comprehensive sexual health education in schools all around America will help to combat these disparities on the account of the lack of education being one of the social determinants of health that contributes to higher teen birth rates. With the lack of conduction of STD testing and the high rates of sexual activity among young people, there should be a bigger push for the induction of comprehensive sexual health education. In 2019, according to the CDC, it was reported that 38.4% of high schoolers have had sexual intercourse, and 27.4% reported being currently sexually active. Of the sexually active students surveyed, 45.7% reported not using a condom during last sexual intercourse. However, only 11.9% of high school students reported not using any methods to prevent pregnancies during the last sexual intercourse. The lack of condom and contraceptive use among adolescents is a concerning health prospect. Students were surveyed upon why there was a lack of protection used in sexual activities. 22.4% reported that it was due to lack of education, and 53.7% believed that if comprehensive sexual health education was offered, it would increase the rate of protection use. Different schools have different prospects of how they receive their funding, meaning some must rely on federal funding for the sexual health education programs. There are two major federal programs for schools to choose from: Title V abstinence only until marriage program, and for funding of comprehensive curriculum, personal responsibility education program referred to as PrEP. However, issues for funding should not be the determining factors for schools of the type of curriculum that they decide to choose for their students. Instead, they should choose a program that addresses the problems facing their students. A comprehensive sexual health education provides students with an education that can be used to build lifelong healthy behaviors to support the improvement of sexual health and well-being. Studies have shown comprehensive sexual health education helps reduce the rates of STDs, unplanned pregnancies, the engagement in sexual activity, and in risky sexual health behaviors such as having unprotected intercourse at a higher rate than abstinence-only programs. This is because in comprehensive curriculum, students are educated about abstinence, but also about how to properly protect themselves from STDs by using condoms and with the use of contraceptives. Offering comprehensive sex education also works to create a safe environment for students where they feel safe to discuss sexual health topics and seek advice or resources that they need, resulting with a positive impact on their health. Overall, nationwide in America, comprehensive sex education and programs should be taught to provide the youth with vital life skills needed to make informed and thoughtful decisions to better their sexual health and well-being. Comprehensive education can be implemented with more investments from the government into health clinics. Investing in creating more health clinics throughout the nation will help create a large variety and would give a large variety of individuals access to sexual health service, helping to better the lives of not only the students, but other individuals living in the community, as well as furthering funding for the programs that support teaching comprehensive sex education in schools. Currently, some programs offer to fund schools that offer comprehensive sexual health education, such as PrEP, but more federal and governmental funding needs to be offered to begin implementing comprehensive sexual health education programs that will help to better the sexual health and well-being of students all over America. Thank you, and these are my resources.